This year, the Minister of Basic Education will introduce national policy, the norms and the standards and regulations to empower all partners in the basic education field toward the implementation of the Act. Now, to ensure that the economy has the skills that it needs, we are increasing the production of artisans through TVET colleges. Now, this is part of the shift we are undertaking towards education and skills development that combines formal learning with job training. Now, drawing on the models that have proven to be so successful in other countries, we're calling on the private sector to offer young people experiential learning opportunities while they undertake their studies. We are implementing phase 1 of the comprehensive student funding model for higher education to address the needs of the missing middle. This will support approximately 10,000 students in the first year. We want a nation in which there is quality health care for all. This year, we will proceed with the preparatory work for the establishment of the National Health Insurance. Now, this includes developing the first phase of a single electronic health record system, the preparatory work to establish the ministerial advisory committees on the health technologies and healthcare benefits, and an accreditation framework for health service providers. The NHI will reduce inequalities in healthcare by ensuring that everyone gets fair medical treatment. Now, the NHI will save many lives by providing a package of services that include, for example, even more especially, maternal and newborn care and services also for people living with HIV, those with TB, and those suffering from non-communicable diseases such as heart disease, cancer, and diabetes. Our most immediate priority is to strengthen the health system and improve the quality of care. A vital part of this is the modernization, the improvement, and the maintenance of existing health facilities and the construction of new hospitals and clinics. A number of hospitals are under construction or are undergoing revitalization. Now, these include the Limpopo Central Hospital, the Siloam District Hospital in Limpopo, the Tabeng Regional Hospital in the Free State, the Bambisana District Hospital, Zitulele District Hospital in the Eastern Cape, and the Bupelong Psychiatric Hospital in Northwest. Now, our projects, rather other projects, are at various stages of design and development. Now, this includes the replacement of 3 existing new central hospitals, 5 new district hospitals, 5 community health centers, and a new psychiatric hospital. To improve patient experience, we are putting more emphasis on reducing waiting times, cleanliness, and staff attitudes in the public health facilities. We are encouraged by the great progress the country has made towards ending HIV and AIDS as a public health threat. By the end of March 2024, 96% of people living with HIV knew their status. 79% of these were on antiretroviral treatment, and 94% of these were on treatment with virally suppressed conditions. Now, to ensure that we reach the target of 95, 95, 95, which has been set by the World Health Organization, we will this year launch a massive campaign to look for an additional 1.1 million people who are not yet on treatment. We are concerned about the potential impact of the decision by the United States government to suspend some of its funding for HIV and TB programs in African countries for 90 days. Now, this funding that we get accounts for about 17% of our country's HIV spend. We have been able, over the years, to provide funding from our own resources, our own fiscus, for our HIV and TB programs. We are looking at various interventions to address the immediate needs and ensure the continuity of the essential services that we might lose if this funding does not come through. Now, to tackle inequality, we do need to undo apartheid special planning, which has scarred our country, our cities, and forced many people to live far away from areas of work and opportunity. We have delivered millions of housing opportunities since 1994, providing safety as well as dignity to poor households. Yet the practice of building housing developments on the periphery of urban centers has in many ways perpetuated inequality and urban sprawl. Going forward, we are going to build more housing in our city centers and closer to places of work and business. Now, we are redesigning our housing subsidies and directing more funding towards programs that enable people to buy or rent a home in an area of their choice. We will release more underutilized state properties for affordable housing development. And we are working with our provinces and metros, and I'm glad that a number of our premiers are here as well. We're working with them to reclaim buildings that have been hijacked in the city centers and repurpose them for public use. Now, we will provide 300,000 service stands to qualifying beneficiaries to enable housing development in well-planned, connected communities along key development corridors. We will clear the backlog of title deeds for subsidized housing, turning homes into household assets. And we will review land use, building, and other regulations to enable low-cost property development, including backyard housing. This represents a fundamental rethink of how the state delivers housing at scale while turning our cities into engines of growth and opportunity.